Hello guys, welcome to Medycoding.com. So this is the second lecture of anatomy, and in this lecture we are going to study the second organ, that is ureter. So ureter is the second organ of the urinary system. The first organ, kidney, we already saw. This lecture is all about the ureter. So let's get started. So ureter is a tube that carries the urine from the kidney to the bladder. The length of a ureter is around 25 to 30 centimeters, and the length is the same as the length of the duodenum. So this is a very important question in medical, okay? Now, what is the position of the ureter? As we already saw in the first lecture, that kidney is a retroperitoneal organ. Similarly, the ureter is also a retroperitoneal organ. So it lies behind the peritoneum. The ureter starts from the renal pelvis at a point of the renal pelvis, that is a uretero-pelvic junction. The ureter begins at uretero-pelvic junction. So this area is known as uretero-pelvic junction because ureter and the renal pelvic join here. And after this, we get proper ureter. Now let's start the courses of ureter. So, what is the course of ureter? The course means the part of the ureter. So, ureter go through different regions like abdominal region, like pelvic region, intramural part, it means some within the bladder. So, in this figure, you can see here. So, from this position to this position is abdominal part because it lies in the abdominal region. And from this position to this position, that is pelvic part because it lies around the pelvic area. And the last one is the intramural part, means some part lies inside the bladder. So these are the part, or you can say these are the course of the ureter. Abdominal course, the abdominal course starts from the pelvic ureteric junction, or you can say uretero-pelvic junction. Both are the same. So in abdominal region, ureter descends down through psoas major muscle. We have already seen in kidney lecture, psoas major muscle go parallel to kidney. Next, spinal vertebrae L2 to L5 lie in the region of abdominal course. Pelvic course. Ureter enters the important point that is known as pelvic brim. And after this point, ureter enters into the pelvic cavity region. So what is pelvic brim? Pelvic brim is the imaginary line that separates the upper part of the pelvic, as you can say that greater pelvic, and the lower part of the pelvic, that is lesser pelvic. Lesser, that is also known as true pelvis. It is because it contains pelvic organs, bladder, uterus, rectum, etc. Greater pelvis or upper pelvis, that is also known as false pelvis. It is actually part of the abdominal cavity, supports abdominal organs like intestines. The ureter also crosses the important pelvic region, that is bifurcation of the common iliac artery. So it is the point where the artery is divided into two arteries. One is the internal iliac artery and others is the external iliac artery. Intramural course. Okay, so this is the last course, or you can say this is the last part of the ureter. So we had divided the ureter into three parts, or you can say three courses. The third course, that is known as an intramural course. Intramural means within the wall. So, for this course, some part of the ureter is going on the wall of the bladder. The ureter is not entering vertically. It is going by making an angle by having an inclined angle. So, the purpose of this is to avoid the backflow. So this angle helps to protect the backflow of the urine from the bladder back to the ureter. It is acting like a natural valve. So the next topic is natural constriction of the ureter. So the ureter is getting narrow at some point. And this is the natural anatomy of the ureter. It is not caused by any condition or disease. So there are 3 points. The ureter gets narrow. The first is pelvic ureteric junction. We already know this location. So at this point, the ureter is narrow. The second is pelvic brim. So we already read the pelvic brim. So at this location also there is stricture. You can see in this figure. This area is pelvic brim. The next is vesico-ureteric junction, VUJ. We can say vesico-ureteric junction is junction where ureter enters the bladder. The term vesicle means storage, and here it is used for bladder. So at all 3 points, there is the chance of obstruction of the stone is maximum due to this natural stricture. So, why ureter is very important for surgery, especially for female? It is because ureteral injuries can happen during open or endoscopic pelvic surgery. More than half of these injuries occur during gynecologic surgery, while the rest happen during colorectal, general, vascular, or urologic surgeries. So, we are ending this lecture and thank you. For downloading, visit www.medycoding.com to get this PDF. If you are watching this video in YouTube, then must visit website medycoding.com, the best place to learn medical coding. Because in website, you will get more anatomy videos. The same topic video that you are watching now will be updated after some time with more clear explanation.